I am therefore particularly delighted to introduce this 10-part series in which the Royal Society of Medicine will position health and well-being at the very centre of the discussion around climate change, with the crucial aim of promoting an understanding of its impact on human health.
Good evening. Welcome to the Royal Society of Medicine. My name is Dr. Niraj Shah, and I'm the President of the Respiratory Section of the Royal Society of Medicine. And I'm delighted to welcome you to the second episode of our climate change series, The Dangerous Air We Breathe. Today, we're focusing in on the respiratory system and the effects of climate change on the respiratory health. It's particularly timely that we're having this webinar today because the ERJ, the European Respiratory Journal, has just published a strong call to arms from a broad spectrum of academics for urgent and persistent action against air pollution and its effects on the respiratory system. We are delighted to be joined by an excellent panel of speakers today who worked in all aspects of air pollution, from the mechanistic impacts of air pollution on cell biology through to the clinical impacts and through to policy making. And with that, I'm delighted to introduce our first speaker, Professor Frank Kelly. Professor Kelly holds the Humphrey Babcock Chair in Environmental Health at Imperial College London. He is an internationally renowned expert on air pollution and its impacts on health. And today he's going to provide us with a broad overview of the way climate change is changing the air that we breathe. So Professor Kelly, a very warm welcome to you.
Thank you very much. Well, hello everyone, and welcome to this meeting. The title of the presentation I will be discussing is how will climate change be affecting the air we breathe. But before I do that, I just want to start off to remind you that we wouldn't accept to drink dirty water. We wouldn't accept to eat contaminated food. So why would we expect to breathe dirty air? It's simply not good for our health. And there are very good statistics to support that. So this is a global burden of disease data published in 2019. And you can see that air pollution is fourth in the list here, responsible for a loss of life expectancy of 1 year, 8 months. And this is split between outdoor air pollution, here as ambient PM 2.5, and household air pollution. So together, both these environments where we have to move between as part of our daily lives are responsible for leading to not only respiratory effects, but a whole range of chronic diseases. And to bring that more close to us here that live in the UK, here's some data from air pollution episodes back in 2015. In March and April every year in the UK, we do have a number of pollution episodes, mainly arising from a lot of agriculture activities, both in our own country and in Europe, leading to the secondary PM 2.5 formation. And this leads to increases in pollutants in our cities where most of us live. Now, during this first episode, there was 1,200 additional hospital consultations. And during the second episode, which lasted a little longer, there was 2,300 additional hospital consultations. And a lot of these were for respiratory complaints. So the quality of the air we breathe is having a major impact on us and on our health. So going to the topic of tonight's presentation, how is climate change affecting the air that we actually breathe? Well, more intense extreme weather events are projected under future climate change scenarios. And we see these and we read about these nearly every day. There's an increasing risk of severe fires. You can recall the fires last year in Australia and in California, and the increasing regularity of these terrible fire episodes, which clearly lead to a dramatic increase in the release of particulate pollution, which really has a major influence on the areas in which the fires are occurring. And quite often these are near to cities where, again, many people are residing. In addition to increasing risk of fires, we have increasing risk of severe droughts across the world. And this sandstorm that you can see here can lead to a dramatic increase in respiratory symptoms of those who experience these in the Middle East regularly. And for those of you who have been following the news in China regularly, some of you will know that Beijing has experienced 2 major sandstorms in the last 10 days. And you can see from this photograph that the sky on these days has turned yellow with the sand dust which has been blown in from the western part of China into cities like Beijing on the western coast, or sorry, on the eastern coast. So in addition to these natural events, we also have, of course, increasing temperatures during following the impact of climate change. And these are predicted to lead to the increase in a different type of pollution, ozone. This is a very, very severe respiratory irritant, this gas, and only a small increase in it can affect even the breathing of normal individuals, never mind those with already compromised lung function. And if it's not bad enough when we consider the social injustices which we already have to live with in many of our countries and many of our cities, it seems as if climate change may actually increase these social injustices further. Because if we consider how many of our cities are laid out, green space and heat island risks are not evenly distributed often across urban areas. And it's often the poorer housing areas which are more affected by these climate change induced effects in air quality. And this next slide shows some data which came out of California back in 2010, where they showed that a 10 degrees increase in Fahrenheit temperatures led to an increase in preterm risk across these 16 counties in California. And the biggest risk was associated with the Black community, much more so than these other communities. And this was associated primarily with their exposure, clearly, to this increased temperature and the dramatic heat island effect which they were experiencing there. And then as we think about holistically about the air that we breathe, it's not just the particulate matter, the PMs and the PM0.1, the ultrafines, which we need to worry about, or these gases such as ozone, which I've already mentioned. But the air we breathe actually has biological components as well. And these include bacteria, viruses, and fungi. And there is an open question at the moment, really, as to what and how climate change is going to affect the impact of these biological components on our lungs. This is really an open area of research which we need to move much faster on. And then finally, most of you will be aware of the question around increased pollen allergenicity. We know that the increased temperatures are going to lead to a prolonging of the pollen season for many of us, but there also is a real risk that the increased temperature will lead to protein changes in the coat of the pollen, which could increase the allergenicity of that pollen and therefore make even more of us suffer from these effects on a regular seasonal basis. So finally, in conclusion, future climate change is likely to exacerbate air pollution mortality and will be influenced by more intense extreme events, such as stagnation events, which will lead to poorer air quality. And these extreme weather events may be an important mechanism by which climate change will affect air quality, and especially fine particle concentrations and ozone, which we know have these dramatic impacts on respiratory health. Thank you.
Professor Kelly, thank you for that overview. It's worrying, but throws up so many questions for us. And just to just to say to all our audience, we will be having a panel discussion with our panel. So if you do have any questions for our panel, please do pop them in the Q&A box. So I'd now like to introduce Professor Kalpana Balakrishnan. Professor Balakrishnan is the director of the World Health Organization Collaborating Center for Occupational and Environmental Health, based in Chennai, India. And she's going to talk to us today about the scientific methods available to us in addressing air pollution and climate change. So Professor Balakrishnan, welcome.
Good evening, everyone. Thank you, Neeraj. I'm delighted to be part of this webinar series addressing the health emergency of climate change, organized by the Royal Society of Medicine. And it is indeed a great privilege to share this e-podium with my close colleagues, Dr. Frank Kelly and Dr. Arvind Kumar. Today, I would like to share some perspectives on healthy breathing spaces that are needed to protect human health, respiratory health in particular, across all global regions. And as you can perhaps appreciate from images here, there is considerable heterogeneity in the exposure settings across the world. Health damaging ambient and household air pollution exposures is an everyday reality for millions in low and middle income countries, while populations in developed countries are increasingly concerned with climate mediated risks from allergens in the air and extreme events such as forest fires and dust storms. The dual challenges for respiratory health directly from air pollution and indirectly via climate change mediated pathways pose an enormous burden. But until recently, our actions to address this interplay have been largely compartmentalized. So I wanted to share some recent information and learnings that argue for a more holistic and inclusive approach so that the most vulnerable amongst us are not left behind. Shown here is the distribution of air pollution exposures to fine particulate matter and ozone in the ambient or outdoor environment, as well as household air pollution exposures resulting from the use of solid biomass cooked fuels. In 2019, nearly 90% of the world's population experienced annual average PM2.5 concentrations that exceeded the WHO air quality guideline value of 10 micrograms per meter cube. And despite steep reductions in the proportion of the world's population relying on solid cooked fuels, we still have over 3 billion relying on this inefficient source of energy for their everyday needs and experiencing exposures within and outside their homes. Basically, despite all that is known about air pollution and health and the long history of regulation, findings in 2019 show that little or no progress has been made. Dangerous levels of air pollution persist in low and middle income countries, while new evidence indicates that health risks persist at even lower levels, and thus even high income countries would need to continue their efforts to reduce exposures. Air pollution accounts for more than 1 in 9 deaths globally. It is estimated to have contributed to some 6.7 million deaths worldwide in 2019. Specifically for respiratory health impacts, it is worthwhile noting that air pollution contributes to some 40% of deaths from COPD, 20% of deaths from lung cancer, and 30% of lower respiratory infections in children. Moreover, air pollution can lead to reduced lung function, recurrent lung infections, and aggravate asthma in adults and children, but these impacts are not currently included in the global burden of disease estimate. So any health burden that we have estimated is perhaps an underestimate. And now with new evidence that in utero exposures to air pollution can impact birth weight, the implications for lung growth and development with associated implications for life cycle impacts on respiratory health are dramatically increased. And to add to top this comes the nexus between air pollution and climate. Climate change represents a massive direct threat to respiratory health by promoting and aggravating respiratory diseases or affecting risk factors for respiratory diseases. Rise in temperatures, extreme weather events, including more frequent flooding or dust storms, substantially increase respiratory morbidity and mortality among adults and children with chronic lung diseases such as asthma and COPD. The impacts of meteorological and air pollution-induced changes on allergens, including pollen, and the growth of allergenic plants on exacerbation of allergic respiratory diseases are significant and expected to worsen in the coming years. Rising temperatures also contribute to elevated concentrations of ozone and particulate matter, further exacerbating the already pervasive direct health impacts from air pollution. Shown here are some complex interlinkages between climate change and air pollution that could exacerbate the potential for respiratory health risks via direct and indirect pathways. While the health impacts from the dual challenges of air pollution and climate change concern every one of us, the biggest gap in risk perception is perhaps on the scale of inequities in vulnerabilities that in turn make the impacts highly unequal across countries and sometimes even much smaller geographical boundaries like districts or even cities. 90% of the poorest billion live in sub-Saharan Africa and South Asia. 80% of the poorest billion are younger than 40 years, live in rural areas. Greater than 80% experience 5 or more deprivations as per the Global Multidimensional Poverty Index. And this includes relying on biomass cooked fuels, low levels of access to safe drinking water and sanitation, limited access to electricity, unsafe housing, and lack of access to education and universal health coverage. These deprivations not only impact maternal and child health, but have enormous implications for adult non-communicable diseases, including respiratory diseases. And climate change and air pollution threaten the very existence of these vulnerable populations by preying on these deprivations. You can recognize easily that there is no scope for climate resilience within this population unless efforts are dramatically stepped up to address these needs. So I want to conclude by saying that climate and air pollution are really two sides of the same coin. Air pollution is not going away without concerted and sustained actions. Actions on air pollution are critical, and without actions on air pollution, it would be virtually impossible to mitigate climate impacts. Climate change is real and is affecting us not in a removed, distal, abstract manner, but in a concrete, direct way that is happening right under our eyes. And the health impacts, as I mentioned, as we understand, are at best an underestimate. The impact on health can be very unequal, even within limited geographical boundaries and across socioeconomic strata. Disease surveillance is critical to understand linkages, and capacities for disease surveillance, unfortunately, are not very well developed in all regions of the world and needs to be considerably enhanced. And we as healthcare professionals really need to shoulder a greater burden of this health messaging in every possible way that we can. Thank you.
Dr. Balakrishnan, thank you very much. I think it's there was a really elegant way of explaining to us how air pollution and climate change are completely intertwined, and we cannot deal with one or the other without dealing with both. So thank you very much. I'm sure there'll be lots of questions for you at the end of this, and I look forward to having a discussion with you about that. So finally, I'd like to introduce Professor Arvind Kumar. Professor Kumar is a thoracic surgeon and chairman of the Institute of Chest Surgery at the Medanta Hospital in India. Professor Kumar is going to talk to us about the ill effects of air pollution on the respiratory system and the crucial role that the healthcare profession has in dealing with these. So Professor Kumar, welcome to the RSM.
Thank you very much. Good evening, and my sincere thanks to the Royal Society of Medicine for this very kind invitation. I bring you greetings from Landcare Foundation, which is a social impact trust working in India for the care and cure of 2.6 billion lungs of India. A question often asked to me is why a doctor is talking about air pollution. He should actually be treating. Now, to answer that question, I'm going to show you 2 photographs and 2 of my horrifying patient experiences, which will answer this question, why I'm doing what I'm doing. Now, I'm a lung surgeon. I have been operating on lungs for close to 35 years now. And this is my experience from the operating room, which I'm bringing to you. On your left, ladies and gentlemen, is the photo of a lung, which is normal, pink color as we are born with. And on your right is the lung not of a smoker, but a so-called non-smoker, but resident of a polluted city, that is Delhi. And more horrifying, now this was an adult, but more horrifying picture which brought me into this space is this picture, which is actually the lungs as seen by me during surgery for some other reason of a teenager who's born and brought up in Delhi. If a teenager has these kind of deposits on his lung surface, now what is going to happen by the time he's 40, if at all he reaches 40, is a question I am unable to answer. Two patient experiences. Lung cancer I have been treating for over 3 decades now. Mostly these patients are in 50s and 60s. Recently, I saw a 34-year-old lady, a non-smoker from a non-smoking family, who unfortunately I diagnosed as lung cancer. And few months later, another 28-year-old lady, again a non-smoker from a non-smoking family, again diagnosed as stage 4 lung cancer. And this slide summarizes the changes that I have seen in lung cancers over 30 years of my practice. So I started my practice, on the left side is 1988 when I started my practice, and on the right side is 2018 when I analyzed my recent data. 90% of my lung cancers patients at that time were smokers. It was a rarity to find a non-smoker, but today, ladies and gentlemen, this distribution has changed to 50-50. 50% of my patients are non-smokers. Average age from 50 to 60 has come down to 30-40. No women at that time, or very few women. I have 40% women patients. I would normally see pink lungs except in smokers. Today, it's a rarity for me to see pink lungs, even in so-called non-smokers. So why have I noticed this huge change in my short lifespan of, or clinical lifespan of 30 years? And the reason lies here. We breathe 25,000 times a day. And now WHO tells that breathing polluted air is like smoking. It is a carcinogen. And truly, there is no non-smoker in polluted countries. And in terms of damage, 22 microgram per meter cube of PM 2.5 is equal to 1 cigarette. So how many cigarettes did I'm a non-smoker or so-called non-smoker, but how many cigarettes did I smoke in 2018? In 2018, in the city of Delhi, the average PM 2.5 was 143. So number of cigarettes is 6.5 per day, which comes to nearly 2,500 plus cigarettes. So, ladies and gentlemen, if you are breathing in a polluted city, the breathing is going to kill you. And this, unfortunately, holds true for the newborns also, because newborns also breathe the same air. So I say that in a polluted city, even the newborns become smokers. And as Dr. Kalpana mentioned, and as Dr. Frank mentioned, this damage does not wait for us to be born. This damage, now there is enough data to show that this damage starts even before we are born, because these pollutants cross the placental barrier and start damaging these children even before they are born. I often am asked which are the organs which are affected by air pollution, and I always show this photograph. Well, friends, these are the only organs which are affected by air pollution. Unfortunately, if you look at them, there is no organ which is left in the body, which means that air pollution harms each and every organ in the body. So I would summarize by saying that in polluted cities, breathing kills and life of billions of people is at stake. How does it kill? Let me show you an experiment to show what is happening inside the lungs. What I was seeing in the operating room, a couple of years back, I got a replica made by HEPA filter, where we made these lung replica and put an exhaust fan behind it to make the Delhi air pass through it. And you see what happened. When we started on 3rd of November 2018, this was the color, and just 5 days later, you see how this color has changed. And this exactly is the change which is happening inside our lungs also. And this is not just confined to India. I'm sure all of you are aware of this famous case where even in London, now this has been recognized that pollution is cause of death in this case. So what do we do? How do we clean this air? As a doctor, what I want to say is that the biggest stumbling block today is lack of awareness. People are just not aware of the magnitude of the problem, of the amount of damage that is occurring to the present generation, and more importantly, our next generation. So as a doctor, for me, the biggest task is to raise awareness, because that is what is going to awaken the people. And when they are awakened, they will take action. And I think, as Dr. Kalpana said, the medical professions have to lead this fight. Why? Because we are motivators. Why am I talking at 11 o'clock in the night on this topic? Because I see the effects of air pollution every day in my outdoor clinic, and I'm horrified by what I see, and therefore I am motivated to work on it. Moreover, when I talk to my patients about this, they listen to me, so I am a good motivator. So doctor is a motivated motivator. So when we have these kind of messages going out that about lung cancer in a young lady, or children having lung development affected, these kind of messages going out from doctors will lead to a positive change. And that's why we have formed this group called Doctors for Clean Air, with the help of our international partner, Healthcare Without Harm, which is an India-wide network of passionate and informed doctors leading the fight against air pollution and climate change. What do? We increase awareness about air pollution. We talk to the patients. We can put up the poster. If I put up a poster like in my clinic, in India, breathing kills. Now that will always start a dialogue with the patient. We can organize community camps and numerous other ways. We need to also engage with medical fraternity, because unfortunately, even amongst the medical fraternity, the knowledge about the existence and the depth of the damage is actually low. So training seminars, workshops, making history taking about exposure to pollution mandatory in history taking, conducting local studies, reaching out to members of fraternity, and various other measures can be taken. We need to engage with the media to organize their training programs, use the media to build a public momentum, and use health advisories. Most importantly, we as doctors also need to engage with the policymakers by writing letters, emails, phone calls, meetings, and collaborating with similar organizations from across the world. So there is a lot that we as doctors can do, and therefore I would like to use this opportunity to invoke doctors from around the world that, friends, this now air pollution and climate change is a serious health emergency, and no one is in a better position to rise and raise the world against this than doctors. So it's upon us, all the doctors, to inform the public, make them aware of the massive damage it is causing, and request them for immediate action. The time to act was actually yesterday, but even if we do it today, it may still be better than not doing anything. And I would like to end by quoting this, that alone we can do so little, but together all of us can definitely make a change, and we must do it. Thank you very much.
Professor Kumar, thank you. That's a really compelling call to arms across the whole world, and it's very, very welcome. And I think it's really important, as you highlight, the crucial role we have as healthcare professionals in increasing awareness amongst our colleagues and our patients. So thank you for that. I'd now like to put some questions to the panel. So I'd like to introduce Dr. Mimi Malhotra, who is the Vice President of the Respiratory Council at the Royal Society of Medicine, and Dr. Sachin Anant, who is the training representative of the Respiratory Section of the Royal Society of Medicine. So Mimi, Sachin, welcome, and I know you have some questions to put to our panel.
Yeah, great. Thanks so much, Neeraj, and thank you to our incredible 3 speakers. I think hopefully everyone will be joining us on the screen and we can start this panel discussion. I think we've got so much to cover in the next 25 minutes or so, but really looking forward to it. So our first question, which has come up in the chat a couple of times, but was also pre-submitted a few times, is about really trying to understand what the medical professionals can do, what clinicians on the front line can do, but also what academics can do to really influence change within the government, within the law, to help reduce these harmful impacts of air pollution. And I don't know whether Dr. Kumar, you want to start on that, as I think you were just about to get into it. So what can doctors on the front line do to influence policy and change the law?
So thank you very much. As I just said, that I think doctors are in the best position to lead this fight. And I would like to repeat that for me, the most important thing that doctors can do is to talk about it, and talk about it, and speak loudly and clearly across the world that breathing in polluted cities kills. If we send out this message, there will be kind of a public uprising. And when the public starts demanding clean air as a matter of right, the policymakers and all others will respond, and we will see the changes which we have not seen till now. Dr. Mimi.
That's great, thank you. I don't know if Professor Balakrishnan or Professor Kelly, you want to come into that as well?
Over to you, Kapala.
I also think that I totally agree with Dr. Kumar that we really need to sort of feel that it is important for us to increase our voice in various circles. But one other important thing that I think as practicing professionals we could do is to facilitate data that comes from our clinics and from our hospitals and from our fraternity of practicing physicians, especially in countries like India, where access to secondary data is not exactly very easy. And if doctors could sort of really help in systematically organizing data collection around what they see in their clinics and in much more systematic ways, these can be interfaced much more readily with exposure data sets that are now becoming available on the public domain. Epidemiologically, if the evidence is generated from the country's own data sets, then that's a very powerful risk communication tool to policymakers. As much as we know the evidence and the time to act is now, I think there is always a need for additional evidence, and we might actually be picking up some important trends that are very unique to the particular exposure setting that we are dealing with. So I think doctors can and should participate in research and definitely contribute to organization and collection of data surrounding health conditions impacted by air pollution and climate change.
That's great, thank you. Professor Kelly, did you have anything else to add as well?
Thank you. Very briefly, I think over the last 5 years or so, I've been involved in a number of conversations with the Royal Colleges, and it's clear that there is an increasing interest and understanding of the challenge here. And what we need to see, and what I think many colleagues agree, is we need to introduce more of this topic and issue into the medical curriculum because we're not training our doctors about this at the moment, and we should be, because the evidence now is irrefutable. Maybe 30 years ago it was questionable, but it really isn't anymore, and we need to be training our doctors with this knowledge base.
That's great, thank you.
Can I just add another line to that?
Yes, of course.
Okay, so continuing with what Dr. Kalpana said, that doctors, I 100% agree that doctors need to participate in carrying out epidemiological studies. Another area where doctors can help is in translating the results of these complex research papers into simple, easy to understand messages. So, a very complicated paper coming in Lancet, if you send it to people, they may not be able to make anything out of that. But if doctors can get a 2-liner or a 3-liner message giving the sum and substance of that article, it would go down very well with people. That's another important role we can take. Dr. Mimi.
Yeah, thank you. And I think hopefully at the end of this session, we'll have a few calls to action and clips that are played as well. I actually wanted to touch on something else before we go into the kind of deeper into the realms of what doctors and clinicians can do, but actually to think about the role of the healthcare system itself. We know that the NHS contributes to around 40% of public sector carbon emissions. And in 2020, the National Health Service kind of signed up to be carbon net zero by 2045. I was wondering, Professor Kelly, do you think that's achievable, and what needs to be done to make sure that that goal becomes a reality?
Well, the quick answer is an awful lot needs to be done, because as you just illustrated, they're an enormous contributor to the problem. And I think it is being recognized now across the health sectors. And I think there will be a lot of action. A lot of green plans are being published. A lot of climate emergency documents are appearing. And if you read these, you'll see that things from procurement to staff, patient travel, waste management, sources of electricity power, all these need to be addressed if the NHS is going to reduce its carbon footprint. But I think there is a will, and I think there is a way.
That's great. Nice to have a little bit of optimism amidst everything that's being presented. That's great. I also wanted to ask about specific advice we can give to patients that are living in areas that are heavily polluted, both within inner cities in England, but also globally. And these are really for patients that are unable to leave due to their socioeconomic conditions or other things. And I know lots of you touched on kind of deprivation and this increasing inequalities, but in particular, what can people do? And I know, Dr. Kumar, you've spoken before about the role of air purifiers and masks being kind of like a band-aid. And I know, Professor Kelly, you've worked on the ultra low emission zones in London, but it would be good to see kind of what range of activity is out there that could be able to help our patients.
Thank you. Truly speaking, if you are living in a highly polluted area and you cannot leave that area, then sadly, it's like, somebody who's wearing a white dress being asked to jump in a dirty pond and asking a question, well, how can he avoid his clothes from being dirty? So if you are living in a highly polluted city, there is very little that you can do to actually avoid damage. Damage will definitely occur. Nonetheless, if there are people who are living and they are not able to move because of socioeconomic reasons, one of the first things is to reduce the exposure. So they could, even within that area, we know that there could be spot to spot changes in these. So there could be some highly polluted and some less polluted. So they could move to a less polluted area. One, we could advise the use of masks. Now, I, for one, am not I'm totally against the use of masks as a long-term solution to pollution. However, if somebody has no choice but to be living in a polluted area, they could be advised to use N95 mask, worn properly most of the times, which will reduce. They should not do any outdoor physical activity, and they should have a properly ventilated house. And most importantly, the diet has to be good, because if you also suffer from malnutrition, the effects of air pollution get much worse. So these are some of the things they can do to reduce their damage caused by air pollution. But I must say that none of these are going to stop the damage. At best, they might minimize it minimally.
If I could come in regarding the UK situation and maybe other parts of Europe, a lot of our pollution comes from the transport sector, especially in the inner city areas. And, we need to put pressure on local government, national government to improve that. But until that happens to a satisfactory level, we need to increase individual awareness of where the pollution is. So we need to educate them that it isn't close to roads, that they need to try and avoid. They need to try and avoid rush hour if they possibly can. And there are apps now available, for example, in London, such as the City Air app. So it's like Google Maps, and you put in your origin and destination of your journey, and it will give you the quickest route, as Google does. But then it'll give you second route, which will say this will reduce your exposure to pollution by 30%, but it's going to take you 15 minutes longer. So digital technologies are becoming available to some of the populations to help them understand where they would be exposed and how to avoid that exposure.
Okay, thanks a lot for those really practical answers. I'm just going to slightly change tack and think about the slightly larger picture. So in November, as I'm sure most of you know, the UK will host the 26th annual UN Climate Change Conference of the Parties, aka known as COP26. And each country in attendance will be expected to announce actions that they will do in order to tackle climate change. I know you guys have picked on some of these before, but I'll just go with Professor Kelly. What in particular would you like to see the UK announce at COP26?
Well, as you know, the UK is out, I think, in the front at the moment with its ambition in becoming net zero by 2050. Now, of course, that's good rhetoric. What we've got to make sure is we put in place the plans to ensure that we achieve that goal. And so I want to hear more about those plans and the money behind those plans. But what I'd also like to hear is that many other countries across the world start following the UK's lead in this respect. And we have to move much quicker to a situation where we have zero emissions, because that is the only, it's the only solution for the climate change challenge, and it's the only solution for air pollution, because we know the two are intertwined with fossil fuel use. Thank you.
And Dr. Kumar, what would you like India to announce at COP26?
So for me, fossil fuel is the biggest culprit, and I definitely would like to have more focus on how to reduce our dependence on fossil fuel. Along with that, I would also like a strong move towards increasing our forest cover, which I think acts as carbon sinks. I also would like the focus to shift from pure economic growth as it is today to more related to overall human development, with human development index being the epicenter rather than just the economic growth. So these are some of the things which I think I would like the government to propose.
Okay, great. And if the current trajectory of climate change and air pollution were to continue, to what extent do you think respiratory health will be affected in 10 to 20 years' time? And any of you can answer that question.
Shall I? Okay, so if the current trends were to continue, and if we were looking at, say, 30 to 40 years later, it's not just the respiratory problem. I would like to reiterate here that one of the biggest problems which I think is emanating from climate change is this huge number of epidemics and pandemics that we are seeing. And the reason for that is not far to seek. Because of various changes, there is a lot of migration of the animals, and there is an increased animal-human interaction. And if you look at the number of infections, pandemics, and epidemics that have happened in the last 20 years, more and more of viral infections, which hitherto were unknown in human, and they are coming from animal sources, including the current COVID, is occurring with regular frequency. And my fear is that this is going to continue in times to come. So not just respiratory, so COPD, lung cancer, emphysema, increased incidence of asthma, increased incidence of tuberculosis. These are respiratory issues which we all know about, but there are numerous cardiac, brain, lung health and other issues. But as a doctor, what I fear is that there is going to be more and more of COVID-like epidemics in future if we were not to control this menace of climate change. Sachin.
It's interesting that you link air pollution and climate change to other organ systems. One of the questions that we've got in the Q&A is the impact of air pollution on the reproductive system. I think one of the delegates has asked, do you think that there's a link between air pollution in India and increased rates of premature menopause that we're seeing in India compared to other countries?
So there is data now which is clearly showing the ill effects of air pollution on reproductive system, and the area study include from libido to performance to the sperm count and the function of ova. All these things are now being slowly but surely being shown to be affected by these things, ultimately leading to decreased reproductive organ function. And also related with that is the impact which I talked about on the newborns, on the yet to be born baby, which for me is the biggest area of concern. So increased incidence of congenital malformations, intrauterine growth retardation, premature birth, intrauterine death, and high incidence of perinatal death and perinatal problems, and high incidence of problems during the first year of life. All these are now being clearly documented to be occurring with higher frequency in pregnant ladies who are living in polluted cities. And this is a very, very frightening scenario. Sachin.
Yes, I agree. That's very disturbing indeed, actually. Another question that we've got from the audience is, did the lockdowns that half of the world seemed to have undergone over the last year, did these lockdowns have an immediate impact on air pollution? And did they have an impact on people's respiratory health? Dr. Balakrishnan, do you have any idea?
Indeed, the lockdowns did, have a significant impact on air pollution concentrations. You must have seen pictures of, the India Gate in Delhi suddenly, against a backdrop of blue skies, which hasn't been seen in recent times, and so forth. So it was clear evidence that emissions had significantly reduced and the concentrations had. And this happened across the board, actually, in most states and most large cities. But unfortunately, these were too transient. Even with the partial lifting of lockdowns, the concentrations crept up very close to where they were prior to lockdowns. So if you look at the annual average of 2020, it's just marginally lower than the annual average of 2019 in most cities. While the lockdowns serve to demonstrate how we can quickly achieve gains in exposures by some, stringent sweeping actions, clearly lockdowns are not the way to go to achieve this, but it just was proof that in most cities, if you did what we have been recommending to do, there was always a lot of skepticism if the air quality would actually improve, because it was always somebody else's problem. But it became very clear that local sources of emissions were a primary contributor to high concentrations in most cities, and the air quality did improve. But it was also a sobering reminder that all it takes is a little bit of normal levels of activity, and we would go right back to it. So we really need to rethink our ways that we are using energy for transportation and all the other purposes that we have to do in cities, as well as for the household sector, before we can sort of really make major dents in air pollution exposures.
In the UK, the situation was a little bit more complicated, because what we saw in the first lockdown was, of course, traffic levels fell off dramatically in city centres. And so we had a big reduction in nitrogen dioxide concentrations because of the reduction in diesel emissions. But at the same time, we had increases in PM2.5 concentrations. And that's because of, as I mentioned in my presentation, agriculture at this time of year is a big producer of secondary PM. And this is coming in from the south of England and from Europe. So we actually had one pollutant going up and the other coming down. And then to add to that, when we actually considered the exposure that people were receiving because they were staying at home and working at the kitchen table quite often, then they were actually getting exposed to more cooking emissions. So it ends up being a very complicated situation and very variable probably in different parts of the world.
Can I add, Sachin?
Of course.
So definitely what lockdown, clearly I echo what Dr. Kalpana said, that for the first time, many of our children actually saw blue skies in India for the first time. And a lot of Delhiites had never seen India Gate as clearly as we saw. Himalayas were seen from areas many thousands of miles away. All that was there, which was a reminder that if we were to take correct actions, this problem can definitely be solved. Now, regarding health impacts, I just want to make a categorical statement that there is enough data available which has clearly linked rise in PM 2.5 and other pollutant levels to increased attendance in the ER related to respiratory events, cardiac events, as well as stroke events. So stroke, heart attack, and acute asthmatic attacks and pneumonia attacks are things which are clearly linked. So whenever there are periods of spike in PM 2.5 levels, a few days later, you will see all the ERs reporting much higher incidence of these emergency arrivals. Sachin.
Thank you. In the interest of time, I think we've only got a chance for one last question, and I'd like all of you to answer it if possible, and then feel free to add any closing remarks as well. This has been truly incredible and the time has really flown by. So our final question is, if you had the opportunity, what one intervention or what one policy would you implement tomorrow to mitigate against the future risks of climate change on respiratory health for our populations?
I
think
would
that's
go for
an easy one.
Okay.
I know. Save the best till last. Dr. Kumar, I think you were ready to go. Great, challenge well accepted. I look forward to it.
No, Professor Frank first.
Thank you. So fossil fuel use has to be eliminated. The extraction and the combustion of fossil fuels, if we manage to eliminate that from society, then we're going to be a long, long way to improving not just climate change, but also air quality. Thank you.
So if I was to implement one change, I would aim for a fossil fuel free world.
If I were given one chance to use fossil fuels for a useful purpose, I would want to use it to eliminate household air pollution exposures. I think that's the biggest use of fossil fuel that I can find totally justifiable. In the near term, populations in low and middle income countries, it has been shown that liquefied petroleum gas, or LPG, remains the most useful source and accessible source of energy in the near term, till we can get to renewable sources of energy for cooking for all populations. But until such time we find alternatives, I think it is highly imperative that household air pollution exposures in low and middle income countries be eliminated. And they are also in a position to provide not just air pollution benefits and air pollution associated health benefits, but also climate benefits.
That's a really nice spin on it. Thank you so much. Great way to end the session. I'll be handing back to our chair now, Neeraj, if you're around. But thank you once again from our side.
Thank you all. Well, what an evening. It's flown by. I'd first like to thank our excellent speakers this evening. While the talks have been quite stark and perhaps quite worrying, I'd like to see them as a call to arms. Sorry, I think I was muted there. I'd just like to say thank you to our speakers, our excellent speakers this evening. While the talks have been, I suppose, worrying and quite stark, I'd like to see it as a call to arms. The biggest thing I've taken away is all the things that we can do as healthcare professionals. And the most important thing at this stage I think we need to do is raise awareness. There are 500 people on this webinar. If each of us speaks to 2 people, and those 2 people speak to 2 people, and those people speak to 2 people, eventually, we will raise awareness. And I think we really need to. It's quite clear from the talks today that we really need to, and I hope that we can take this forward. I'd also like to thank all of you, our audience, for joining today. we've had lots of interaction on the Q&A, and thank you for your questions. And I do hope that you've enjoyed it as much as we have. Just a few closing remarks from me. So please do fill in the survey that you receive, as we do appreciate your feedback. And CPD points will be issued to everyone who completes the survey. And to all of those watching a recording of this webinar, please remember that CPD points will only be issued to those watching on demand through Zoom, not YouTube. We'll provide full resources and a recording of this webinar in a follow-up email. And of course, we must thank Mr. Michael Rapp for his generous support, which has allowed free access to this webinar for all. I'll end just to highlight our next episode in this series, which is Skin in a Warming World, and this will be on the 13th of April. Full details are available on the website, but I'm sure this will be an interesting and detailed view of the impact of climate change on dermatology. I'll close this episode with two very short videos. These are from organisations who have reached out to us who wanted us to raise awareness about their campaign, which is Health for a Green New Deal. So the videos have come from Global Action and MedAct. They won't take very much of your time, and I do hope you enjoy them. A very good evening to you all.
Hello, my name is James Bates, and I'm a Programme Officer here at Global Action Plan. We're the charity behind Clean Air Day, and we believe what is good for the planet is also good for us. So I support the health sector portfolio on clean air, and one of our main projects is the Clean Air Hospital Framework. This is a self-assessment tool for hospitals to develop a clean air action plan or embed clean air actions in a net zero strategy or green plan and track progress against this. We also run the Mobilising Health Professionals project, which is a pilot about exploring how health professionals can provide air quality advice to patients. So we are asking you and your organisation to get involved with Clean Air Day on June the 17th. You can head to the Clean Air Day website for more information, or you can email us on cleanerair@globalactionplan.org.uk. Thank you.
Hi, good evening. I'm Rob Hughes, and I'm a clinical research fellow at the London School of Hygiene and Tropical Medicine. But I'm also a dad of 2 young kids, and I've had enough of the air we breathe, making us, our families, patients, and our planet sick. We're working with MedAct to lend our voices as health professionals to try to make sure that clearing the air is central to the mayoral election here in London and to politics across and even beyond the UK. We want to ensure that the economic recovery from COVID is a clean, green one that promotes and protects public health. If you're interested in joining us, please follow us and message us via Twitter. Check out this QR code up here, or go to the MedAct website to learn more. And please do join us. We really want to build this campaign and make sure this isn't just about science, it's about action and lending our voices where they can have an impact. Thank you.